So what do you think? What would you say to Romney if he were, when he walks in? He's going to be here. If you,
all the candidates, what are you going to do for me? My family. You know, my husband works 2 jobs. I just came back to work. I was disabled for 2 years. My hands were really bad. And we had a rough time making it.
I just want to say hi to all of you. I don't mean to interrupt your lunch over here. Some folks are just planning on having lunch. Didn't know a politician was going to come in. It's ruined their whole meal. And I apologize, but I just want to say hi to a few friends that have gathered here. This is a very famous place. I understand Adam Sandler's been here. So
they all talk about health care till they get in there. But they all have health care, don't they? Do they have to pay outrageous co-payments for everything? No. You should see my medicine bill at the end of the month for me and my children. I have a diabetic daughter, I have a daughter with Crohn's, and I have an ADD son.
I do believe that one of the great resources we have is what I'll call health care diplomacy. That nations that are moderate Islamic states as well as African states that are in dire poverty can draw closer to America and recognize our values and our goodness as a nation, in part by our sharing with them the technology we have and the medicines we have and our know-how in the area of healthcare. And despite what Michael Moore said, we are the envy of the world when it comes to healthcare technology and capabilities, and we can reach out and help other nations. We've done so with a very...
How about our nation? How about the USA?
And we've done so with an enormous effort in a number of nations in ways that aren't recognized, and I'd like those to be better recognized. And I will tell you, before you leave, Miss, with regards to our nation, one of the things I'm proud of being able to do in my state is putting on track, you know, as governor of the state next door, putting on track a plan that gets everybody health insurance. And that was, in my opinion, one of the great things that had to happen. And I'd like to see, frankly, I'd like to see all of our...
all high co-payments.
Pardon?
After we pay our huge deductibles for our insurance and our costs for our prescriptions, there's nothing left.
Are you Massachusetts resident?
No,
or?
I'm a New Hampshire resident,
oh, well,
and we pay over $1,000 a month for our insurance, and then we have co-payments every time you go to the doctor's, $50 a visit, and then you have your co-payments on your prescriptions. Can you tell me how much your co-payments for your prescriptions are?
Yes, $10 for each prescription.
That's very nice, isn't it?
Yes, what are yours?
Mine are like 30 to 50.
If I get,
and,
I get
know,
certain...
I have 3 sick children. I have a daughter that has Crohn's. She's had Crohn's since she was 11. Her doctor took her out of college this year. Guess what? She is no longer insured.
Well, one of the things I think is important to do, as you've heard me do as governor across the border, is to find a way to get health insurance for all our citizens.
Yeah, but how are all your citizens paying for all the deductibles?
You know, if you'd like me to answer the question, I will.
All right, how much are your citizens paying for deductibles? The same amount as you?
Well, how much? Everyone has their own plan, because in our state they're private insurance, and we get to choose the policy that we'd like. And so we have 4 different major plans that are offered by 4 different insurance companies. You get to choose the policy you want, and you get to pay for the policy that you want. And let me finish, if you will. I can see you're ready for the next one, but let me continue. For people of higher incomes who make $54,000 a year or more, they pay for their own policy themselves. For people who are earning under $54,000 a year, then we help them with subsidization to help them purchase their own private plan, but we help them pay for it. And in those cases, they don't have big co-pays, and they don't have deductibles, because this is, of course, a subsidized plan. But it's private insurance, no government plan. Instead, we help people buy their own private plan. So based on their income, people can buy the program they like.
Do this, didn't Hillary?
Well, we did this in our state. We did it in our state.
And now Hillary supposedly was going to do this when she was...
I didn't like her plan. You see, it was a government plan. I don't like the government takeover, government taxes, socialized medicine. She had a plan. She had a plan.
Now she wants to be president after running from her state, going to New York to be a senator.
Who's paying for the subsidies if it's not the government of Massachusetts?
And here's how it works. In our state, we found it cost us more money to be giving free care out in hospitals, that's what we were doing, than to help people buy their own private care. So we took the money we had been using, federal, state, and also money from our insurance companies. We took the money we had been using, giving out free care in hospitals, and said, we'll help you buy private insurance instead. And is it perfect? No. Could it be made better? My guess is we'll find there are ways to make it better. But I'll tell you, when you got problems, you don't just step back and say we're doing nothing. You make progress. We got it done. Republicans and Democrats got it done in my state. I'm proud of what we did there. It could be a model in a lot of ways for other states, including New Hampshire, and we'll try and make it better. But if I'm lucky enough to get elected president, I'm not going to just sit back and talk about problems. We're actually going to do something about it. Washington has talked about it for so many years. I'm really proud of the fact that we took action to get the job done in our state. Now listen to someone else.
Well, maybe they should live in our shoes for a month, just to see how it is.
Exactly.
It's not pretty.
Yeah.
Especially when one person is out of work.
I think
3 sick children.
don't do as well as you like.
You know, and I'm so sick with designer clothes, all these fancy cars. They walk around like, you know. Now, he was in here for over, what, an hour?
No.
Coming in and out, that's money off my
Yeah, I know.
table.
They're like, Governor, can I have like a picture with you?
Absolutely, happy to. These poor guys are trying to have lunch.